I'm joined today by two people leading the call for change to the status quo. Teri Sopp, longtime attorney and public defender in Jacksonville and Nassau County. Thanks for being here.
Thank you, Ann.
State Representative Sam Garrison represents Northern Clay County and also an attorney and former prosecutor. Welcome.
Morning.
Glad to have you both here. Representative Garrison, I'll start with you. You said mental health is going to be your priority in the upcoming legislative session. Why focus on that issue?
Well, I think because it's an issue that demands attention. I mean, when you get to the legislature, all of us have passions that cause us to run. But sometimes events take control and guide the crafting of your priorities. And I've just found over the last 2 or 3 years, especially coming out of the COVID pandemic, that more and more conversations that I have with my constituents eventually come around to someone in their family, a close friend who's struggling with mental health, mental illness. And so you start hearing that enough and you start thinking maybe something's going on. And so we start looking into the numbers and we're starting to get the data coming as time starts to pass from the peak of the pandemic, and the numbers are just staggering. I mean, the incidence of increases in anxiety, depression, suicide, especially among teenagers and young adults is staggering. And, we've got to try to focus on it.
And you've got young adults in your family. You've got your wife is a teacher. So that's a conversation that you're hearing not just in Tallahassee.
Yeah, I'm a dad. I've got a daughter in college and one in high school, and my wife's a high school teacher. So we're around this a lot. But honestly, this is whatever group I talk to, whether it's a church group, political group, Chamber of Commerce, whatever it is, when you start bringing up the issue of the concern that we have, specifically about young adults and struggles with mental health, primarily probably as a result of these cell phones we all have and we're looking at right now. Every single time I bring that up, heads start nodding in the audience. Doesn't matter whether I'm talking to Republicans, Democrats, Independents, doesn't matter. It's a human issue right now. And what's encouraging from my standpoint is we see an evolving consensus in Tallahassee across party lines that something has to be done. And the question always is, what do you do? But at least before you can fix a problem, you have to understand it. And I think we're taking a long way forward towards actually understanding the scope and the seriousness of the challenge we have in this area.
And you recently wrote an op-ed for the Florida Times-Union about mental health. You suggest in that article, starting with the most severe acute illness and treatment needs. So if the problem is being seen a lot among the younger cohort in Florida, why start with sort of that group of mentally ill and sometimes homeless people?
Sure. I think one of the things that's driving the conversation from a policymaker perspective is what I just described as a parent, what we're seeing with our young adults and the concern a lot of people have about where we're going as a culture. But, the issue of mental health has been around for a long time. I was a prosecutor for many years and dealt with this in the criminal courts for a long time. And quite frankly, just driving down to the stadium downtown to see the Jags beat the Titans last night, you notice a difference driving through Jacksonville, unfortunately, in the last few years, and the number of folks who are homeless and giving signs of some sort of behavioral health crisis. So whenever you've got a massive problem like that, how do you eat an elephant one bite at a time? When you have a big problem like behavioral health issues, mental health issues, where do you start? You start at the most serious issue where I think 100 people have 100. Look at those folks who are in the most serious acute distress and say, they need help. We need to do something. And that's where you start.
Teri Sopp, you've been a vocal advocate of a system that would allow for extending civil commitment to help the acutely mentally ill. What is civil commitment?
Civil commitment is what's known as the Baker Act in Florida. It was reconfigured after the 1976 Supreme Court decision of O'Connor versus Donaldson that basically required deinstitutionalization from what were then fairly horrible medieval institutions, way out of sync for the time. And so the Baker Act is to make sure that people get due process and that people who are mentally ill are treated with respect, and that only the people who are mentally ill are committed to involuntary treatment. But unfortunately, for the last 50 years, the deinstitutionalization model has not been successful, primarily because of the lack of an overarching framework and the lack of funding. It's interesting that Rosalind Carter died yesterday because she was one of the initial people who tried to work in the late 1970s towards a more community-based mental health care framework. And a lot of what she did is still in place today, but unfortunately, we've really got to expand what I call the other side of the Baker Act. People can be Baker Acted. You see people who are psychotic or a danger to themselves or cannot take care of themselves. They can be taken to a receiving facility. They can be taken before a judge, have a lawyer appointed to represent them, and committed. But what happens after that is tragic and often the biggest failure in the deinstitutionalization model. And that is there's no mandated aftercare. There's nothing to say that the person that's been Baker Acted and stabilized on emergency medications often, that there's anything that's going to happen to prevent this from arising again. Mm-hmm. And that's what we've got to look for the California model and the New York model.
I want to ask you about the Baker Act. So that, for people who aren't familiar with it, that's basically up to a 72-hour hold. Is that correct? And people can be stabilized, but then are often released either back to the streets or to a homeless shelter, very often without their family's knowledge.
That is correct. That's what we see a lot. I work downtown every day, and I walk back and forth to the courthouse 3 or 4 times a day. So we see it. Everybody who works downtown and even in some of the outlying areas like Five Points and Riverside, you see the people who are in desperate need of what I call managed care who are not getting it.
And you've worked as a defense attorney and a public defender for decades. And last December, you wrote an op-ed for the Times-Union. You said, quote, "The best treatment an indigent, mentally ill person can hope for in Jacksonville is being arrested for a mental health court eligible felony." Explain that.
Well, there are 3 separate specialty courts in the 4th Judicial Circuit. Mental health court is designed to keep the people who are mentally ill out of the criminal justice system. And if you qualify for that program, that program is amazing. You go into mental health court any day, and there's a group of social workers, case planners, housing specialists, disability specialists, Social Security managers. I mean, there's everything that you need all in one place, and we need those services in one place for people who are not in the criminal justice system.
I want to come back to that, but we've got a call. Eric from Arlington has and just comment about the root of this issue. Good morning, Eric. Go ahead.
Oh, yeah, good morning. Hold on. You there?
Yep.
So I have a boatload of experience with this, unfortunately. This subject is having a family member who fits into the category that you guys are talking about. And at the root of the issue is money. I mean, you could talk about court and everything else and the legal system, but unless there's a robust middle class where people can afford to take care of their loved ones at home, or the tax structure is such that we can raise money to, pay for the proper treatment and housing and so on for people who are mentally ill. It's either one or the other. And until billionaires start paying their taxes again and corporations start paying their taxes again, this isn't going to change, in my opinion. Thank you.
Thanks for the call, Eric. Sam Garrison, what do you say to that in terms of it being a money issue as much as anything else?
I like to say the answer to all your questions in Tallahassee is money. But I think the bigger issue, to Teri's point, she brings up a really good observation that I think 2 things are worth noting. Number one, the single largest healthcare provider in Duval County is Sheriff T.K. Waters, because his jail has to provide healthcare services, mental health services for many of the misdemeanor offenses. And it's not fair to him and his deputies. And it's also just not sustainable financially. So let me just say that to piggyback on Teri's point. The second thing, she makes a really interesting observation about specialty courts and mental health court, and I agree with her 1,000% on that respect. Mental health court, drug court, those specialty court things that we can do to be smarter and the criminal justice system are very important. The caveat there is one of the reasons that mental health court and these specialty courts are so successful is because it's both carrot and stick. You have opportunities for treatment, you have the carrot, you have the wraparound services, but the stick element of it is if the individual decides they're not going to avail themselves out of those opportunities, there's real punishment. There's real consequences as a result of that. The challenge in translating that to the non-criminal justice area is that you have carrots, but you don't have stick. And so in a situation where you're dealing with folks with acute mental illness, oftentimes who don't want to take the medication, oftentimes who for any number of reasons resist the treatment, if you don't have that ability to say, if you don't do this, this is going to be the consequence, you can have all the money in the world. It's just not going to be effective unless you have that sort of accountability in the treatment process.
If you're just tuning in, we're talking about ideas to solve the problem of untreated acute mental illness. Do you know someone who needs treatment? Do you think the courts should be involved? Give us a call at 549-2937. Shoot us an email at firstcoastconnect@wjct.org or tag us on social media. So, Teri, this seems like a good point to turn to California's CARE Act. It's being implemented now. It provides but also compels care in these cases. Describe what it is.
Well, it sounds like the perfect response to Sam Garrison's point that there's no stick in the civil case management, and that's what we need. We need what I call and what the care court in California is going to provide, managed care. And so what happens is someone is Baker Acted, involuntarily committed. If they are stabilized enough that they don't require inpatient psychiatric services, then what aftercare do they get? As Representative Garrison says, they're often released to an adult congregate living facility, a boarding house, with no managed care, no case manager. There needs to be, it's sort of like probation. It's almost like a civil probation. It's a plan to assist the individual to stay mentally healthy, if that requires medication, if that requires not living on the streets, if that requires nutrition, or if it requires, often people have other significant physical health problems. You can just walk around downtown and see the sad state of health care of some of the acutely mentally ill that are living on the street. Those things can all be addressed, but there will be a stick. It will be like probation. If they don't comply, if they relapse, then they can be subject to tighter management or commitment to a long-term care facility. And we'll see how that works. I'm really hoping it works well in California. I would love it if the legislature would set up a pilot project here in Duval County. I'd be happy to work on it, work with it, help. But I would love to see a pilot project of care court here, and let's see how it works.
And so the idea in California is that it would implement this stick to sort of enforce the civil commitment parameters, the requirements of someone's discharge. Opponents of the program say that forcing treatment on people is a violation of their rights. California Governor Gavin Newsom responded to this in a recent 60 Minutes interview. Let's hear a little bit of that.
Change has its enemies. I get it. But one thing you cannot argue for, with all due respect to all the critics out there, is the status quo. You can't. And in the absence of alternatives, what the hell are we going to do to address this crisis?
Sam Garrison, the issue of individual liberty, obviously a very important issue. Where do you personally come down on this, the question of kind of a compelled care?
Well, I think it's difficult because of what you talked about. I mean, personal liberty is a really big deal. And so anytime you're going to restrict someone's liberty, whether it's because they've committed a crime or something like that, it should have the ultimate respect for, in accordance with, due process and making sure that all steps have been taken. It gets way more complicated when someone has not done anything wrong. They haven't committed a crime. They're posing a threat to themselves or others. And so, I'm personally a believer that one of the good things we do about the Baker Act statute is we do have provisions in there for due process. To Teri's point, those provisions have not been updated in 30, 40 years. I mean, it's been a long, long time. And one of the things that I know you will see come out of this legislative session, I've been part of the working group that's been a part of it. One of my colleagues out of Okaloosa County, former judge, former United States Army General Pat Maney, has made this his his primary focus during his legislative service is you're going to start to see a Baker Act modernization bill come out through the legislature this year, hopefully to increase efficiencies and avail ourselves of modern technology and some of the kind of the clunkiness of the original statute, so we can try to be more responsive to things as they come out. But you absolutely must have due process through this process. But I will tell you, before you can do anything, one of the challenges that we have in California, I can't speak to California, they've got their own issues out there, but we have to do, we have started, and I'll credit the governor for taking some lead on this. We have started doing an overhaul evaluation of where we are in our forensic facilities in the state. I mean, we have six state mental hospitals in the state, 3 of them in North Florida, 3 of them in South Florida, and various needs of, just physical repair. The plant is old. Half of them are run by the Department of Children and Families. Half of them have been privatized. We're working on a long-term strategy to make sure that do we have the beds? I mean, you could say all you want, but unless you have the bed space for folks who need that care, it's all just talk. So step number 1 is making sure we have that baseline infrastructure to make sure we have the beds to take care of the folks that are in crisis.
We've got a call. Janet from the Beaches wants to comment on early intervention in mental illness issues. Good morning. Welcome to First Coast Connect.
Hi. Well, the root of the problem is the mental illnesses themselves, and the earlier we can address them, the better. And I know a lot of, I heard that parents did not want mental health counselors in our schools. This is where you're going to identify mental illnesses. Parents aren't always the best ones to identify them, because you can have a child with a mental illness in their teen years. This is when it hits them, and the parents say, oh, they're just going through a phase. But how do they know? They're not. See, this is why we do need the mental health counselors in the schools. Early identification is key, and also the key to the best outcome of any mental illness is early intervention. And this a mental illness is no different than cancer or diabetes. It's the same thing. We got to stop the stigma. These people need help. They shouldn't have to go to a hospital and say, I'm a danger to myself and others, when they're not, just to get treatment in this country.
Janet, thank you so much. Thank you so much for your call and comment. So Teri, she raises an interesting point, because there has been a movement by some groups, including Moms for Liberty, to have mental health services, treatment, assessments removed from schools.
I have to admit, I don't know much about those issues because I don't have any children in school. But my sense is the more we can have people looking at people with mental health issues, and the more outreach, the more services. I had an idea last week. It just struck me walking downtown. There are 2 huge rooms at the public library on the first floor. The public library is the day treatment center for the mentally ill, the homeless mentally ill downtown.
By default.
Yes, by default. Let's put some services outreach right there. Let's have some case managers there. How can we help? New York City has done that. Active, proactive social workers. I have to say, I've never seen any social worker. Only one time in the last 3 or 4 years, I saw a social worker interacting with an acutely psychotic person downtown. And that's because she had 2 very young children with her, and they were removing her children, which, of course, needed to be done. But no, that woman is still on the streets and still actively psychotic and no help. So I'm all for as much outreach. Put it out there.
Sam, you said that you've talked to people on the bench who've looked at cases where people are coming again and again and again through the criminal justice system, often for minor offenses, but need this kind of help. And yet they don't, I think you said they don't check the boxes. Describe what you're talking about.
Well, I mean, Teri can speak to it just as well as I can. She's actually in the court system now. My information's somewhat outdated, but any prosecutor or public defender or judge in the Fourth Circuit can give you a litany of stories of working first appearance court and seeing folks come through for chronic misdemeanors, most of the time having to do with some sort of addiction to drugs or mental health. I mean, Congressman Rutherford, when he was sheriff, really pushed hard to try to differentiate between the folks who are in and out of the jail because they are intentionally making a decision to commit crimes, and those who are doing it because of other issues that are beyond their control, and to try to differentiate between the two. He gets a lot of credit in my book for taking that position and trying to look at it. Number one, part of it was because he felt a moral decision to try to differentiate there. And number two is because it was costing the sheriff's office an ungodly amount of money, which it does. When you have someone who is, when Sheriff Waters has someone who is in his jail, who's evidencing mental distress, the amount of money it takes to house that individual is 4 or 5 times what it is your run-of-the-mill person who's sitting in jail for 72 hours. And so it becomes a financial burden as well. That's money we can't spend on other critical needs. Talk to any major sheriff in the state, and they will tell you one of their biggest cost drivers is dealing with these sorts of cases. And the state gets involved in situations where we have people charged with serious felonies who need to have their competency restored in order to understand the charges against them and to communicate with their lawyer as they go to trial. The state does not get involved in those lower level offenses. That's dealt primarily with, exclusively with, by the county. And it's a major cost driver. And one of the things that, we're trying to work through with our sheriffs is, what's the answer to try to take some of that burden off of them so they can focus on what they're charged to do, which is keeping us safe, and not being, the biggest mental health provider in the county.
Teri, so the trigger that a judge is looking at if they want to do a civil commitment is pretty narrow. Someone has to be a threat to themselves or a threat to others, and it sort of has to be an explicit threat.
Well, no, that's one of that can be one reason, but there are other. You can be a danger to yourself or others. You can be explicitly, potentially violent to yourself or others, or you can be unable to provide for your own safety through neglect, physical neglect. That's what we see downtown with the acutely psychotic homeless population. Those are the people that need to be committed, to be addressed in court, to determine whether they need to be involuntarily placed, and if there's an involuntary placement, what is the least restrictive alternative? That's where it comes in, the protection of the individual. We're just not going to warehouse people like we did 100 years ago. We're going to have, hopefully, and this was the idea after deinstitutionalization that the funding got canceled for, is community mental health. We can have halfway houses or reentry houses that managed as if there are reentry houses for people coming out of prison in sort of the same way, managed care, managed supervision. Let's make sure you're going to stay on your medication. If you can work in a sheltered workshop, or if you can get a job, or if you can reunite with your family. I saw recently a case in Pinellas County, a man that was arrested for homicide. He'd been missing from California for 3 years. He'd been living on the streets. They booked him into jail under the name of Beelzebub, some bizarre name, and somehow finally they connected. His family had no idea because he just disappeared into the dark hole of street living mental illness. And those are the tragedies that we really need to try to take care of.
We've got a call, Michael from Duval County. I believe he's got a comment regarding the jail being a mental health facility. Good morning and welcome to First Coast Connect.
Good morning. And the discussion on mental health always seems to circle back to the jail as being a primary source of intake and treatment or initial treatment for the mentally ill. At the same time, we've got people beating the drums for a new jail because the jail is over capacity. So how about if we have a new building strictly for people with mental health problems, and let's try to centralize the services. It's been a great discussion. There's a lot of potential out there. So let's have this specific location with the specific services immediately available and cooperate with the police. This also would have the effect of lowering the population in the jail, and perhaps it wouldn't be necessary to create a brand new structure. Thank you.
Thanks so much for the call, Michael. So, Teri, that's something that is actually being done elsewhere. Can you tell us about it?
Well, Judge Stephen Leitman in Miami, who has for almost 40 years been the leading judicial member dealing with mental health issues in the criminal justice system, finally got an unused building in downtown Miami. Basically, the ninth floor of the Metropolitan-Dade County Jail was notorious for being the worst mental health inpatient facility probably in the whole state. And he has finally been able to set up an entirely separate holding facility for people with mental illness so that they're not in the jail and they're treated more as a medical crisis and a mental health crisis with social workers and physicians and psychologists. So that has been a huge change in Miami-Dade.
Sam Garrison, is there, in your conversations with people like T.K. Waters or before him, Mike Rutherford, or John Rutherford, excuse me, is there any sense as to how much a change like that would diminish the current population of the jail? Like just how many people might be siphoned off to this civil commitment type?
Well, it's substantial. I'll say this: the amount of, we kind of poo-poo the financial cost. The amount of money here is real. I mean, I have great empathy for what the sheriff has to deal with, not just in terms of the manpower necessary to deal with this, but also just the facility costs. I mean, it's very, very, very high. And look, no matter how you look at it, it's like squeezing the air in a balloon. It's gonna move around, but still in the balloon, right? And so, in this situation, the folks who are, whether you're getting care in 501 East Bay over at the jail, or whether it's in a secure facility, it still costs a lot of money to the taxpayers. And so, that's one of the things that we're trying to look at this in Tallahassee. It's a partnership between state and local resources. It is a multi-year project. This is not something you can just snap your fingers and have it be done. This is going to take probably 4 or 5 years in terms of coordinating a strategy for the next 20 years. But the goal is ultimately to again, go back to, before you can fix a problem, you have to understand it. The numbers we're going to see in terms of what Teri's describing, just working downtown every day. I mean, you see it as well. I see it. This is the new normal. There's something going on in the world that's resulting in higher instances of acute psychiatric distress in some of our urban areas, and so we've got to figure out how we're going to address it as a state. And we're going to do it our own way. It's not going to be like Florida's dynamics are unique and different, and so we're going to try to do it the Florida way. I will say, to Teri's point, I will say Miami has done a really good job. And for my South Florida friends, I give a hard time. It's hard for me to say. But the truth of the matter is, Miami's done a great job in addressing issues of homelessness and folks in mental acuity, because they've made a sustained focus of the community for a long time. So there's some things we can learn from other parts of the state as well.
We've got a caller, Shane from Lake City, who's had some experience with the system. Good morning, Shane. Welcome to First Coast Connect.
Hello, how are you?
Good. How are you?
I'm going to try to be brief and to the point. I was released from the Veterans Hospital in Gainesville Friday, and I voluntarily committed myself. I was there, I think, 9 days, and then after 72 hours, they come and they want you to fill out a form to recommit yourself so you can have extended psychiatric care and things of that nature. And I'm an alcoholic, and there's been an issue with me. Matter of fact, today is my 63rd birthday. And one of the questions they ask you when they come in, they have a whole team of people or a couple of doctors, a couple of social workers. They come in your room and they ask you the standardized questionnaire. Like, one of the questions is like, what are your strengths? And when somebody asks you that, you've been living on the streets for 5 years, you're kind of like, I don't have no strengths. That's why I'm here, right?
Mm-hmm.
And then they ask you, what are your goals? And there again, like, almost my entire family has passed in the last handful of years, where you can always say you got a destination, right? Like, you're going to go home or something like that. And I don't have one, you know? And I know you guys, the representative, I can't think of his name, that's on your show right now, and the public defender, you guys, my hat's off. You got your hands full there, because I see it firsthand every day. And, you know, I'm lucid, and I'm capable of understanding, you know, what's going on around me and things like that.
Shane,
But I read,
Shane, this is Teri Sopp. I'm just so moved by your story. I just wanted to just tell you, congratulations on seeking care at the VA hospital, because they do have good programs, and they stick with them, because I have seen them help lots of people I know, clients and friends. And I can just tell you that both Lake City and Gainesville, and even the Jacksonville outpatient clinic, have great programs. So I'm so happy that you reached out to them, and please stay with their care. They'll help you. And I wish you the best.
I just want to add one. I wanted to add one thing. There was an article in the New Yorker magazine. They had a bunch of them in the day room where I was at the hospital, and it's a program that they've initiated in New York City. They got this whole high rise. It's in Brooklyn somewhere. But their initiative is, first, put people in a place to live, and
Right.
then you can address their issues, whatever they are. Some are more severe, you know, than others.
Shane, thank you so much for your call and your candor. And yeah, Housing First has become a big issue. Sam Garrison, what about that? I mean, are we focusing on the right things when we're talking about care, when there isn't necessarily a place for people to live?
I think you can walk and chew gum at the same time. I mean, you're talking, there's such a diverse population of folks. I would say the overwhelming majority of the people that I'm talking about when I talk about the acutely mentally ill, it's, you could have 10,000 available housing units, but no landlord in the world is going to be in a position to incur the liability of issues that are in someone who's in psychotic distress. You know, so it's obviously attainable housing is a big deal. People being priced out of housing because of, you know, for 1,000 reasons. I get it, but that's not what my particular focus is with the conversation we're having right now.
Teri, just your final thoughts before we wrap.
Well, I think the legislature is aware. You know, the Florida Commission on Mental Health has done big reports, 20 years apart. And as the last chairperson of the committee, Charlotte County Sheriff Bill Promell said he really hopes that the legislature can work through all the wrestling it takes to deal with these same challenges again and again. And he said, are they really going to take us seriously? So let's hope so, and I'm happy to work with you, Sam, in any way I can.
Thanks, Teri.
Thank you, Representative Sam Garrison. Assistant Public Defender Teri Sopp, thanks so much for being here. And
Thank
you,
you.
Ann.